My name is Angela Harrington, and I'm the lead speech pathologist at Christus, Southeast Texas. Who needs speech therapy? So if a patient has a stroke or a head injury from a car accident, or if they have lack of oxygen to the brain for a little while, those are all reasons that they could have some language and some speech deficits. The other type of person who could use speech pathology is patients that have Parkinson's disease and they're having a hard time getting their voice really loud, or they're starting to have difficulty swallowing. Sometimes their speech sounds garbled. Both adults and pediatric patients can get speech therapy. We see kids as young as when they're in the NICU and they're having trouble with feeding and swallowing, all the way to patients that are on hospice, and we're just trying to figure out safely what they can eat or drink in their last days. Pediatric-wise, speech pathologists, we help with developmental language delays. If a patient is not really talking on time, or that kiddo, you're concerned that they're not saying enough words or I can't understand them. If a patient has autism, we see a lot of patients and kiddos that have autism and they need to learn how to communicate within their environment and need strategies for that. We also see patients often that have dysphasia, which means difficulty swallowing. So if they have reflux and they're not sure how to manage their reflux and it's making them cough and choke, we would see them. Speech pathology has really increased its presence for Christus, Southeast Texas. We currently now have speech pathology offered for Mid-County at the outpatient center. We also have speech pathology in the hospital where we see our babies and our older people as well. We also have speech pathology in an outpatient setting right across the street from the hospital as well, so that's really convenient.